When it comes to finding a chiropractor today, it's not easy. With so many choices in your community, how do you find the best chiropractor for your needs? It's easier than you think when you know what to look for and the right questions to ask. Today's local chiropractic expert is here to share some insight on searching for a chiropractor who will have you limber in no time.
Hello, my name is Dr. Larry Wilkins, and I'm a chiropractor in Mount Pleasant, Pennsylvania. And on many occasions, I'm asked about the question of what is my opinion on epidurals and cortisone injections. Now, instead of giving you my opinion on cortisone injections and epidurals, what I'm going to do is I'm going to explain to you what research says about each of those. I'm a research-based doctor. Most of the decisions I make is made off of research. Now, the problem that I have with cortisone injections is research that was published from the University of Pittsburgh about 15 years ago. Don't hold me to the year. I kind of lose my track of years, but it was around 15 years ago. And what they did was they did a research project on the area that they put the epidural into. And what they found out is it degenerated that area where they put the shot into. It actually ate the tissue away, whether it was muscle, tendons, or ligaments. And so because of that, what they did was they started to limit the number of cortisone injections that you could have. And I'm talking right now about cortisone injections for the cervical spine and the low back. Now, that's when they limited these shots from giving you 3 or 4 shots a month to only 2 or 3 shots a year. And that was the reason they limited this. So for my reasons with cortisone injections, that's my reason for not having too much faith in those shots. Now, when you start talking about epidural injections, it's a little bit more serious. And the reason is because the epidural injections can cause paralysis and cause death. Now, these 2 years ago, I read research that the FDA did on epidurals. The reason being is patients were having adverse reactions to the epidurals. The adverse reactions were death and paralysis and some other minor things that they were having. So they started to dig into this and they found out that those conditions can be attributed to the epidurals. That's one reason I'm not too in favor of the epidurals. Now, the FDA even gave it sort of a black box warning about the epidural injections. So that would be my reason for not liking the epidurals and my reason for not liking the cortisone injections. Now, another question that the patients will always ask me is what kind of experiences have I had with patients who have had cortisone injections and epidural injections. With that, the basis of what I would tell them is for cortisone injections, let's go with that one first. Cortisone injections, I've had very little response from the patients as far as a clinical analysis when they're coming into me for a consultation. Now, obviously, if the cortisone injection worked, the patient wouldn't be coming into me and I wouldn't be getting that information off consultation. But I was looking at maybe 1 in 30 people would get a positive results from the cortisone injections, which I thought was rather low for the amount of damage that could be done in that patient, so I wasn't too fond of that. Now, as far as the epidurals go, my experience with the epidurals is I have the consultations that I have done with patients, and there's a lot of them. The patients that have had the epidural injections, I would say that 1 out of 10 had a positive benefit from it. The other 9 did not, which is not a good statistic either. So from a clinical standpoint, I wasn't in favor of the epidurals. Now, the other reason I'm not in favor of the epidurals is this. Up until 5 years ago, every patient that I saw that was doing the epidurals or getting the epidural shots, there was 2 results that the patient was had. Either it worked or it didn't work. 5 years ago, I got the 3rd result was it worked, it didn't work, or it hurt so bad that I would never ever have it done again. So I asked some pain management doctors that were friends of mine why this was happening, and their response was it was because the doctor was hitting the nerve when he was putting the needle in, which the patients, just downright said, no, they would never have this done again. So those are kind of like my experiences with the epidurals and the cortisone injections. Third thing I like to talk about is the, because of being a disc specialist, have I ever recommended a cortisone injection to a patient? And when you start to ask me that, I'm going to answer it in two parts. Number one, for the neck or the low back, I've never recommended a cortisone injection for the patient. However, I have recommended a lot of cortisone injections for knees, shoulders, and hips. Now, the reason for that is this. I've already told you that it's going to destroy some of the tissue when you shoot the cortisone into the muscle, tendon, or ligament. However, most of the time when the doctor does his surgery for a replacement knee, replacement hip, he's going to take those parts out of the body, so it's not going to matter anyway. I've seen some nice benefits from the cortisone injections in knees and also in hips. I've not seen very much clinically in cervical, which is the neck, or the low back. The other thing is the epidurals. I've never recommended an epidural to any patient. I was going to do some epidurals with patients if I couldn't get the patient onto the decompression table, but I've never had a patient yet that I wasn't able to get under decompression. Now, a lot of patients will say to me, well, what's the alternative to doing an epidural or a cortisone injection? And I usually tell them, here's the way that it usually plays out for a bad neck or a bad low back. And it plays out this way. You're going to go to a primary care physician, your medical doctor. He's going to give you anti-inflammatories, muscle relaxers, and pain pills. You're going to go back and it's either going to work or it's not going to work. If it doesn't work, the next place that you're going to go is to a physical therapist. He's going to do 6 weeks of physical therapy. If the physical therapy doesn't work, you're going back to the primary care physician. And he's going to recommend at that point in time that you see a neurologist or an orthopedic surgeon. When you go to the neurologist or the orthopedic surgeon, they're going to recommend that you have an epidural injection. And that, from that point forward, either the epidural is going to work or it doesn't work. And if it doesn't work, your next step, if you have a disc condition like a herniated, bulging, degenerative disc, you're going to end up not only having the epidural, but they're going to try to talk you into doing surgery. My alternative is this. You could come to our office. We could do an evaluation with you. My one promise to every patient that I have that I've examined over the course of the last 42 years that I've been in practice is this. I will definitely guarantee you that at the end of the examination, I'm going to sit down with you and let you know whether I can help you or not. If I can help you, we're going to go to work on you and see what we can do. And if I can't help you, I'm going to send you to the doctor that can. And the only way that I can tell you whether I can help you or not is to have an examination done, which is the proper way to treat anybody. I also treat patients who have MRIs. I treat patients that don't have MRIs, whether it's the neck or the low back. I've talked a lot about the low back, but most of the time I'm dealing with patients that have problems with the low back because 80% of the time that's where most of the herniations, bulging, degenerative disc, stenosis come from. 20% of the time it's in the cervical region. So if you're interested in what I said, I wrote a couple of articles that talk about epidurals and they talk about cortisone injections, which I'll post onto our website. And you can go to the website and read those, or you can email me at, these are all case letters, dr.larry.wilkins, W-I-L-K-I-N-S, at email or gmail.com, and that'll give me an email shot to me right away. And I'd be more than glad to sit down with you and talk to you, do a consultation with you and see if there's anything I can do to help you. That's what I would do versus I would get an epidural. And the reasons why are because of all the research that I have read on the epidurals and the cortisone injections. I hope that you've got a little information out of what we've talked about. I hope that you, and if you have any questions, you just shoot me an email and I'll be more than glad to answer that email for you. I've had a great time doing this. If you have any questions, send me an email. Thank you very much.
Pretty impressive, isn't it? And a great chiropractor is always eager to help, one step at a time. Are you hoping to learn more? Our expert can be reached by calling the number on your screen. Thank you for your time.